first, you all convinced yourselves that hating trans people was about women's safety in public bathrooms. Then you convinced yourself that it was about fairness in sports. Then you convinced yourselves that what if minors are getting surgery? Or what if puberty blockers are making them sterile? Well, now the government wants to tell us how our underwear should fit. Trump has released new FDA regulations that would have chest binders and compression tops registered as medical devices. Why would anybody do that, you would reasonably ask? To restrict access. And depending on how restrictive this is, perhaps create a database of who is purchasing this. Maybe you need a prescription to buy them. Maybe you can't buy them if you're under 18. Maybe they are considered a controlled item, like a controlled substance, and you have to show an ID and have it logged when you buy one. What it doesn't do is make life easier for anybody, bring down costs, do any positive thing that he promised to do. If you don't know, a chest binder is exactly what it sounds like. It is an undergarment, sometimes with some kind of Velcro tightening closure for a custom fit. Sometimes it's kind of shorter, like a sports bra length. Other times it's longer, more like a tank top that covers the entire torso. And it is meant to create a more flattened chest for a more masculine or androgynous profile. And a compression top is an even less intense version of that. Compression top is kind of in between a sports bra and a binder. It usually doesn't have any fasteners. It just has a little bit more of a restrictive feel to it than a sports bra. Before chest binders were an actual product that you can buy, people who wanted the same effect would use ace bandages or sometimes duct tape when an ace bandage was not available. Yes, an ace bandage, that thing that you would use to really tightly wrap up injuries so that your joint doesn't move around. You would take an ace bandage and you would just wrap it really tightly around your chest and wear that all day, every day, which can result in bruising, difficulty breathing, long-term tissue damage, and broken ribs. So a chest binder or a compression top is a really great, safer alternative that is made for this one thing. And guess what? It's not just trans people who use chest binders. Yes, there are some medical uses for chest binders. If you are somebody recovering from certain kinds of surgery in the chest or shoulder area, certain chest binders under advisement of your doctor can give you some relief for some of the pain or restrict movement while it heals in a less painful way. Some cis men might also make use of these tops because some cis men have excess mammary tissue. And yes, that does qualify as gender-affirming care, and yes, that's fine. Someone who is breastfeeding might enjoy some light compression to alleviate some of the swelling and discomfort. Similarly, if you experience really intense PMS and there's a lot of tenderness, some light compression can also alleviate that as well. And a lot of cis women will occasionally use a chest binder to do their jobs more effectively or more comfortably. As I said, as a more intense version of a sports bra for doing various kinds of exercise, going to the gym, to alleviate some of the stress and inconvenience that having a larger chest sometimes creates. Or just as a fashion statement. As we all know, some articles of clothing just fit different when you have a smaller chest, and some people might want to occasionally take advantage of that. And if you're still pretending to care about minors having surgeries, they're really not, but in case you're very worried about it, a chest binder is an excellent alternative because it allows for a person to try the look out, see how wearing a chest binder makes them feel, maybe even live like that for a few years, maybe even decide that getting top surgery is not necessary for them to alleviate dysphoria. For some trans people, wearing a chest binder is all they need. They just want their clothes to fit a little bit differently, and they are not made upset by their naked body. Some trans people don't want permanent surgery because they kind of oscillate between different gender expressions, and they would like the option to appear more androgynous or more masculine without making permanent alterations to their bodies. Again, perhaps a chest binder might just stave off the need to have surgery for a few years so a younger person can make a more informed decision as an actual adult. Isn't that what you want? I don't know how to better illustrate that these attacks are becoming more personal, more intimate, more about trying to affect our access to the world and our ability to make choices. And the more they are able to restrict us, the more they will do it to you. Because if they are able to do this to chest binders, what's to stop them from reclassifying a sports bra, any underwear, any clothing item? At what point will the government just decide how you're allowed to dress based on what's on your birth certificate? And if you think it's impossible, I just got there in 3 steps.